Welcome, everyone, to Mondays with Michael. Happy New Year. Greetings to you. Happy 2023. It is great to be together with you for this first show of the year. This is show number, I believe, 142 in our weekly series, and it's great to be together. So New Year's greetings to you and yours. It is I'm so happy to be together with you all. Please check in the chat. Let us know who you are and where you're calling from. And any questions you have, anything you wanted to share, to check in today, and any New Year's greetings that you'd like to offer, and we'll get going. Really delighted, just an honor to have today's guest with us today. This is for our colleagues in the acupuncture profession. This man needs no introduction. He's one of the most highly regarded, respected practitioners and teachers in our community in the acupuncture profession worldwide, and really honored to have him with us today. Really one of the leading educators, practitioners, authors in the field, and talking to us. Really delighted to begin the year with this particular topic, which has really been extra important in recent years. We're going to be talking about trauma and healing through trauma, and for practitioners who are on today's show, how to work with folks who have been through some trauma, which is kind of most of the world, in a sense, from everything that we've been experiencing in the last few years. Trauma has become, tragically, the norm rather than the exception. And so this subject is incredibly timely and incredibly important. So I'm speaking of Ross Rosen. Ross is with us today, and he is an acupuncturist and Chinese medicine practitioner. I'm going to bring him on camera now as I introduce him, and really delighted to have him with us today. And he is practicing Chinese medicine for decades. He's the author of the text Heart Shock, Diagnosis and Treatment of Trauma with Shen, Hammer, and Classical Chinese Medicine. He'll explain what that means to folks who are not familiar, as well as being a direct lineage holder and senior instructor of Chinese pulse diagnosis and Classical Chinese Medicine, teaching these disciplines worldwide. Ross is an ordained 23rd generation Taoist priest in the Quanzhen Longmen tradition at the Jiangfugong at Qingqing Mountain, and a 25th generation Taoist priest at the Qingyong Dongguan. He is one of the teachers at Parting Clouds Taoist Education. I've had the great honor of collaborating on patient care with Ross. From my 40 years in New York, and working with the state association there for many years, and just being part of, very active part of the community of practitioners of Chinese medicine in the New York, New Jersey area. Ross has been well known to me for decades as, a leading practitioner, and just so delighted he's with us today. Ross, welcome. Great to have you.
Thank you, Michael, for such a generous introduction. I appreciate that. It's really my honor to be here.
That's great. Well, thank you. Thank you. So if you just, for those of you who are not, those of us who are not familiar with your journey, just tell us a little bit about your arc and how a lawyer became one of the leading practitioners and educators in the field of Chinese medicine. Not a common career path, we would say.
It's not. Yeah. My path, I think, is similar to probably a lot of other people my age and young boys who were fascinated by martial arts when they were growing up. And that was sort of my entryway into this world, I guess. I grew up with just a fascination of all things Chinese and Asian. And my parents tell me that as soon as I was able to speak, I was asking to join and had them sign me up for my first martial arts class. So they let me do that when I was a toddler, and I had done it all the way through. And from there, there's little exposures to things here and there, ideas of chi and energy and other types of philosophies, the Tao, and so forth. And
Oh, and Ross, you just check your chat. Let me just leave the chat box open if you can.
you got it. Okay. Yeah. And so from there, I guess moving into college, I don't know
Yes.
that there wasn't really at that point, at least I wasn't aware for me from, I grew up in Staten Island and then sort of moved
Nice.
into New Jersey. And there was no option really for studying this sort of thing. And so I went to college, I graduated with, political science majors and history minors, and then went to law school. And
Right.
I remember someone telling me while I was a student in law school, and the old saying was that if you like law school, you're not going to like being a lawyer, and vice versa. And I was like, oh man, I love law school. I love theory. I love
Yes.
learning. And as soon as I started practicing it, it really wasn't that, right?
Yeah.
It was minutia, right?
Mm.
The day to day wasn't really filled with that sort of excitement of
Yes.
study and theory and so forth. And one day,
Did you have a specialty in law, Ross?
I was, I first started off doing a little bit of appellate work for the public defender's office.
Oh, sure, sure.
And I remember most of that work was sort of like, on the side. It was compiling briefs and
Yes.
transcripts and trying to overturn decisions,
Yep.
right? And and they always said, like, 99% of the decisions sort of stay, so and you're defending, murderers, rapists,
Yeah,
these
right.
types of things. And
Right.
one of my cases got overturned, and
No.
I thought, I can't do this anymore.
Oh,
So it's sort of a crisis of conscience. And then I kind of went into some more business oriented working in more like securities litigation and that sort of thing.
okay.
And that also sort of like sucked the soul
Oh boy.
out of me a little bit. And I was
Wow.
one day in a lunch break, I was behind in my office behind the closed door reading the Village Voice, and an advertisement came up for the Pacific College of Oriental Medicine. It was
Oh,
like,
sure.
epiphany, right? The light
Oh,
bulb went off. I called up, I got the application, I applied, I got in, I quit my job and started all within a couple of months. It was like, there was
wow.
no turnaround. And it was,
Now, during
great
this
sailing.
time, you were still studying martial arts at that time.
I was, yeah.
So you were kind of immersed, at least in some way, in this Asian way of thinking.
Absolutely. And by this time,
it's kind of cool, by the way. You have a 4th-degree black belt in a style I just started about a year and a half ago.
oh, is that right?
I just got
Oh,
my
wow.
purple belt. This is my 3rd style.
That's great.
But Shaolin Kempo is a fabulous style. Really enjoying it. So yeah, you've achieved pretty significant rank in that style through. How long did that take?
Well, I mean, I had bounced around through a few different martial arts over the
Sure.
years, and in college, I moved into the Shaolin Kempo,
Okay.
and I had done that up and through into my mid to late 20s,
Oh wow.
and then sort of transitioned over to Tai Chi Chuan.
Sure. So here you are. So you're a lawyer practicing martial arts. See, not satisfied, doing a few different areas of law, and then you see an ad for an acupuncture school, and quit your job, get accepted to acupuncture school fairly quickly. And so what happened then?
Well, when you jump into something as sort of, even though I was only practicing as a lawyer for a couple of years, but
Sure.
it was sort of leaving something that you thought you should do for the thing that you always wanted to do.
Yes,
right.
yes.
It's just, there's a passion that sort of like almost like leaks out of you. And so I just devoted everything back to being a full-time student at Pacific College. And,
Yes.
I went through the program. Actually, I graduated a little early. I doubled up on courses.
Wow.
I really just wanted everything I could
program.
get. Yeah. And when you're there, you sort of realize that when you're studying Chinese medicine, that one of the main hallmarks of diagnostics is the pulse.
Yes.
And then you sort of reflect on your education and you realize you don't learn pulse in Chinese medicine school.
Not
so,
much.
So right off the bat, I sought out Dr. Leon Hammer of the Shen Hammer pulse diagnosis system. And he, at first, actually, I went and there was a course that was offered at NISA, the New England School,
Sure.
through Dr. Bob Heffron, who was one of Leon's long-term original students. And I
Right.
went up, I registered for the course. I get up there, I'm got a hotel for the weekend. I show up on that Saturday morning, and like the classroom is dark. There's no lights on. I'm like, what happened? I go into like the office, the registrar's office, and like, oh yeah, only 2 people registered for the course, so we canceled it. I'm sorry, we forgot to call you.
Oh, wow.
So, so they very nicely they gave me Dr. Heffron's information. I called him. He felt horrible, and he invited me down to his home in the Maryland area.
Oh, wow.
And I spent a weekend with him, just sort of with me and him, and he
Really?
invited one of his other students in, and we just spent the entire weekend studying,
Wow.
learning the pulse for the first time. It was like
Yes.
mind-bendingly, brilliantly, unbelievable.
Yeah.
And then I kept studying. I set up another course with him, like a 4-day course. I got a few of my friends together, and we went up there. And
Oh,
then he introduced me to Phyllis Bloom. I don't know if you know
oh,
Phyllis.
sure, sure. I
She's
know.
wonderful.
Yeah, yeah,
And I
yeah,
took
for
some
sure.
courses with Phyllis, and she was, so generous with me. And she said, you know what, we've got to get you down to study with Dr. Hammer. So she took me
Mm,
down, where it was a sort of like a very small group of students who would go down for these intensive weekends, 4-day weekends, a few times a year down in
mm.
Florida. And
Oh, wow.
so we did that. And then it was, once you're in, you're in,
Yeah,
once
no,
you,
no. What year was this? As all this went down?
this is
Roughly.
2002, 2003.
Oh, wow.
Yeah.
Wow. That's
And
great. Now,
so,
we have some folks, we have quite a few folks on the show who are not acupuncturists. If you just
mhm,
explain a little bit about, like, just in general pulse diagnosis, but also John Shen, Leon Hammer, and that system,
right,
which I've studied, just, I've studied through Lonnie Jarrett's course,
right.
being
Yeah, yeah,
introduced to that system. But anyway, if you just fill folks in a little bit so they're not, they can caught up, they're up to speed.
sure. So, the pulse is one of the iconic methods in Chinese medicine for diagnostics. And traditionally, within like traditional Chinese medicine, there's a certain small, discrete number of pulse qualities, usually like
Yes.
ranging 26, 27, 28, depending on the teachers. And
Right.
the Shen Hammer method, which was a pulse method that Dr. John Shen sort of he didn't create, but he evolved this
Yes.
system significantly through his studies in the Hmong He lineage
Mm.
in Shanghai, in that area. And he was also an apprentice and a student within the college there. But he also, when he left China, he traveled a lot. He traveled through Vietnam, and we believe that he potentially encountered a system there which sort of was much more sophisticated and intricate.
Oh, I was not
And
aware of that.
yeah, and so from there, he sort of like evolved and blended these systems together.
Yes.
And then Dr. Hammer studied with him for a period of about 28 years
Mm.
in close contact. And then the system, because Dr. Hammer's mind, he's very, he's a preeminent psychiatrist.
Yes.
He brought a lot of the psychological components of the work into the pulse to diagnose a lot of
Mm.
very specific things. And he's very very organized, very methodological and
Yes.
methodical. And so he created a system for actually teaching the pulse.
Right.
And within this system,
Right.
it breaks down into where normally there's three different pulse positions on each wrist, with six total. We now have 28 different pulse positions that we actually
Mm.
maneuver and roll our fingers in different
Right.
crevices and positions and
Right.
looking for particular sensations. And instead of the 28 pulse qualities, we have roughly around 90 different sensations
Mm.
that we can
Right.
categorize on our fingertips. And there's also in this system 9 different depths of pressure,
Right.
and they're all related to anatomical structures, areas, organ systems, tissues, and so
Mm.
forth. And so the way these qualities and sensations combine themselves, because you don't
Right.
just find one quality or sensation in a position, you can find many. And so the
Yes.
way they combine themselves at the different positions and locations and depths and so forth gives us this wealth of information about what's going on in the varied organ systems and systemically.
Right. I have a colleague of ours who I went through Lonnie's course with, saw Dr.
Mhm.
Shen as a patient because he was in
Mm,
Manhattan for a long
right.
time. And and he's checking her pulses, usually, bilateral at the same time. And he's, you eat too much corn. And she's like, how did you know that? It was very she said he was quite a character, like really just eccentric in an awesome way. Just she really loved being with him and seeing him.
Yeah, I mean, the wealth of information really is sort of mind-boggling, and for many people, overwhelming until
Mm,
you have a structure and a way for sort of understanding and breaking
right.
down and prioritizing it. That's
Yeah,
really the key.
that's
'Cause
right.
otherwise, it's like a sensory overload.
Right. 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 If you don't have a framework to put it in. Yeah,
Right.
for
Yeah.
sure. For sure.
Yeah.
So you went pretty deep into the system, and, becoming a senior instructor in that system. And then how did that carry forward into your clinical practice and teaching and further studies?
Yeah. Well, I was really lucky because when I came out of school and I was building my practice, I was starting right off the bat with this particular pulse system.
Mm,
And so, and I was also fortunate enough to have like a pretty thriving practice where I would, I slowed my practice down after a while, but for a long time, I was, really seeing a large volume of patients.
right.
And to be able to get your fingers on the wrists of that many patients, you
Yes.
start to make correlations and associations and see patterns developing
Right.
over a period of time.
Yes.
And so from there, it really informed the understanding of not just the pathogenesis of particular issues that we're developing,
Right.
but also the ecology of that's really lies behind it. And for me,
Mm,
that's one of the most important aspects of it, really,
mm,
because it's what many people call pathology is really
yes.
ecology, right? It's really the body's wisdom
Right.
of trying to adapt and respond, oftentimes
Yes.
in maladaptive ways. But
Yes.
the body does it in ways and with strategies that it has available, right? And so
Right.
that availability of strategy depends on lots of factors, and
Yes.
especially one's constitution and the internal terrain and the
Right.
dynamics where all this is taking place.
Right, right. So a
So
lot of what we call pathology is an adaptive response where the body is doing its best to deal with the current situation and the
right.
challenges it's facing. Yeah.
Absolutely. And I think when, we've always learned, starting off in the Shenhammer system, you sort of learn some pathognomonic findings of particular illnesses, right? So
Right.
things that you feel that are almost like, I mean, I hate to say anything's a one-to-one because there's so many
Sure.
things that are
A
involved,
high
but
correlation.
yeah, high correlation.
Yeah.
And so I started to put together that, the amount of people
Mm,
suffering from
yeah.
some component of traumatic shock to their system
Yes. Yes.
was really overwhelming. It was mind-boggling. And I started
Mm,
to talk to my colleagues, and you would think, in our world, the way, especially like on Facebook, right? Everyone presents, they're curating their lives, right?
sure.
You're seeing everyone's best scenarios.
For sure.
So you think everyone's happy, everyone's going on vacation all the time, and everyone's, loving life.
Right.
But when you start to realize, feeling people's pulses, that,
Mm,
60, 70, maybe 75 or more percent of people have these findings of
mm,
trauma on
mm.
their pulse, and
Yes.
all the ways that sort of creates the knots
Mm,
internally that
yes.
lead to the formation of diagnoses and illness down the road. It
Right.
becomes, it really behooves us to understand trauma, because if you are just
Right.
treating the illness, it's not so different than Western medicine just treating the
Right.
symptoms.
Downstream. Yeah.
Right. So we see the sequela of all these things downstream, but when
Yes.
we trace it back, we
Yeah.
want to see the underlying root causes.
Right. Right. So this led you into quite a deep exploration of this subject of trauma and how it shows up, how it manifests, how to understand it from at least a Chinese medicine perspective, and then how to help people heal through that. And that, I believe, is the subject of your book.
Right.
And what have you learned about trauma and how people can kind of orient to it or kind of understand it or approach these past shocks to the system? And also, I guess part of that is like how we understand shock. And when we use the word shock in Chinese medicine is
Right.
very different than Western medicine. So I know we have some, just looking at folks, I know we have some nurses and physicians here on the coast, and they
Yeah,
hear shock. They say, "Oh, I know what shock is." And they're looking
sure.
at a Western biomedical perspective. So maybe why don't we start there? Like, what
Yeah.
is
Well, let's so
shock?
let's maybe
Yeah.
let's distinguish
Yes.
trauma from
Yes.
shock,
Great.
because they're really different. And for the ease of conversation, it's often used interchangeably.
Yes.
But shock, heart shock, right? The
Yeah.
term heart shock is really a function, and it's really an umbrella term. It's a systemic diagnosis
Okay.
that
Yep.
that culminates from trauma or traumas
Hmm.
that rise to the level of creating instability.
Right.
So, you may fall and
Great
break
way to
your
put it.
arm, right? And if you break your arm, that's a trauma, you have some tissue damage and so forth. But it may not cause a huge emotional response for someone, right? And in someone else, it may, though, right? So that same
Right.
injury may,
Right.
because we're looking at terrain,
Yes.
constitution,
Yes.
right? So, and it's important to note too that all physical shocks, right, will also have the emotional correlate. And that's a really important thing
Right.
to understand when we're treating heart shock patients, because we have to, and I'm sure this term ganying or the resonance has
Mhm.
come up a lot
Right.
in the Chinese medicine circles. But for me, this is one of the most important components of treating trauma shock with
Mm.
our patients, because oftentimes our patients are sort of unaware of
Yes,
their traumas.
for
And
sure.
sometimes, because they've happened so far into the distant past,
Right.
they don't think that they're relevant anymore.
Yes.
Um,
Yes.
And patients are always sort of amazed at how we can tie in a past trauma to
Right.
their current suffering, right? Even,
Yes.
there's particular pulse qualities, for example, that will tell me whether or not someone had the cord wrapped around their neck at birth, or
Huh.
whether or not someone was a breech birth and stuck in the birth canal.
Oh, wow.
And so these things, people think, oh yeah, but that's, I was just born and now I'm 60
Right.
years old. How
Right.
can my cancer be a function
Right.
of that, right?
Yes.
But if we
Yes.
understand the root, and we can see the downstream impacts of that and
Right.
how it creates the myriad branches that come off of that root,
Yes.
then we can start to really get somewhere.
Right.
And when we can
Well,
sort of untie
yeah.
all of these knots that
Right.
have been created along the way over decades, then it
Hmm.
becomes really powerful healing, right? It's
Yeah.
not just the elimination of a symptom
Right.
or a syndrome or whatever it
Sure.
is,
Sure.
right? Yeah,
Well, that's huge. But and I want to underline a couple of things you said, which are really significant. Is that the shock is the effects of trauma on an individual based on how they kind of worked with it or experienced it or dealt with it, or based on their constitution, their
right.
their current consciousness, or at that time. So the same trauma to one person may not result in a long-term deep-seated shock pattern, and another person it will create a pretty significant pattern, uh,
Absolutely.
and that can be discerned through the diagnostic process.
Right. And one of the determining factors of that is specifically the integrity of the nervous system, right?
Mm,
Because this is something that Dr. Hammer
right.
has taught on quite a lot.
Right.
And so the stronger the nervous system, what tends to happen is stresses and traumas create more somatic problems, right?
Huh.
And when we start to see a degradation of the nervous system, what we
Right.
find is that we see more mental, emotional,
Huh.
psychological symptoms develop.
So it's a function of resilience in a sense.
Exactly.
Yeah.
Exactly.
Wow.
Yeah.
Okay.
And the
So
nervous system is like, the nervous system is a really complex
yes.
word. It's a Western term, and it has
Yeah.
to me, it has very sort of different meanings within Chinese medicine. And
Right.
it's a term I think that has never really been fully defined within Chinese medicine. So people
Mm,
sometimes look at that word and someone says, well, yeah, what is that? That's a vague term, nervous
yes.
system. People are tense or stressed or whatever it is.
Right.
But for me, the nervous system is really, it's part of the fire water balance of things,
Yes.
and the wood sort of mediation of that, right? So
Yes.
we can look at it from lots of different perspectives, from wei qi and yuan qi, the relationship. We can look at
Yeah.
it from a mediation of how well the body is adapting to the communication between heart kidneys, right? Between the emotional self, the spiritual self, and sort of the ground substance for the nervous system as a whole, the central nervous system, the marrow, the nervous system, the nerves, and how they fire and so forth.
Right. So so for folks who are not familiar with these type of terms, when we say the word heart shock, that means something very specific in Western medicine. And how would you explain that from your perspective of what we're referring to when we say heart shock?
Yeah, so if we look at it from the Chinese medicine perspective, we can look at oftentimes things are anthropomorphized, right, in Chinese medicine to understand them, right? So the heart is considered to be the emperor, right? And you can imagine this sort of pyramidal structure that the heart and the emperor sit atop of.
Yes.
And everything underneath there, within that pyramid, all the subjects and ministers and people that make up the empire, all rely upon the integrity of the heart or the emperor for its functioning, for smooth functioning. When something happens to the emperor, the rest of the empire falls into chaos. Right. So all the different checks and balances, all the movements that would be happening, become impaired in some way. And
in Italian,
in
Italian, we have a saying, "Il pesce affondo di testa," which means the fish stings from the head.
Yeah, similar idea. Yeah.
Right. So if the emperor is in good shape, for lack of just to simplify, then the kingdom tends to be healthy. And if the emperor is unhealthy or has been injured, this has effects throughout the kingdom.
Absolutely. And it's much like, we would see things, concepts like the mandate of heaven, right? Where the emperor's rule would be sort of divined by the gods or by the heavens themselves. And, when the emperor was not worthy any longer of that mandate, then you would see omens showing up and you would see transfer of power, right? Within our own sort of physiology, we can't really transfer that power. We have to sort of make some corrections.
Right. So the heart being the emperor of the body of the 12 officials that we talk about in the kingdom of the body, mind, spirit. So shock to the heart is that imbalance or out of resonance or disharmony there. And so how do we work with this creatively, either as individuals who've gone through some past shock or trauma trauma that's led to shock, and then we can, talk about how as practitioners might work with somebody with that. But from an individual working with their own healing process, maybe they're aware, maybe they're not, of some past trauma. What have you found helpful, Ross, in working with thousands of patients who have had some degree of this?
Yeah, I think the first step is always awareness, because I think people don't really have a lot of awareness about it. And I think the other part is destigmatizing what it really means.
Okay.
Because, I think our society opens up a lot more on mental, emotional things than perhaps in the past, but I think there's still quite a significant stigma on mental, emotional illness.
Right.
And whether that be people feeling, shame of being anxious or depressed or whatever it is. And I think first we have to bring awareness to an understanding of where it's coming from, and that it's okay to sort of let it out. Because if you don't open the heart, if you don't let some of these things out, it becomes there's a real difficulty in rectifying. Now, but there's also the other side of that. And so there's really two important components here. One is the ability to have awareness and release. The other is when there's not the integrity to release, that one has to have the ability to soothe, right? So self-soothing is also lacking significantly in our culture. I think there's not a lot of mechanisms in place that people learn on how to do this, right? We're a society of go, 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 and more. And so if people don't learn how to shut their nervous systems down
Right.
and to relax their spirit and calm themselves, it becomes difficult. And so
And
I
this is
think
the
that
soothing, that's the soothing path, which may have to be a precursor perhaps to the release part, right?
right,
So what,
right.
what might that look like in your experience for us? What does that look like for people that you've worked with?
Well, one of the most important components of that would be meditation. Right.
Hmm.
And then, of course, what people say is, I don't have time to meditate. I'm too busy. And
Right.
then I give them, the old platitude, the old saying of, if you don't have enough time to meditate for 30 minutes a day, then you should meditate for an hour a day.
Mm. Right.
Right. And so it's crucial. And then the other thing that people say is, well, I've tried, I can't do it, it's too
Mm.
hard.
Mm.
And my answer to that is, it is hard. That's
Yeah.
the whole point. If it was
Yeah.
easy, you'd have a lot of people who were enlightened
Right.
in our society. And that's not the case, because it takes a lot of work.
So for this self-soothing, meditation is one part of that.
Right.
And just for folks who are listening today or will get the recording later, what would be one simple example of that? I know you've got decades of experience in these
Mhm.
practices, but for a novice, for a person who's new to this, what might a simple, like, oh, I can do that, type of meditation as a form of self-soothing look like?
Yeah. Well, I think the first thing to understand before I even go there is
Yeah.
that um, there's a difference between um, meditating
Right.
and relaxation. And
Hmm.
there's a difference between meditating and sort of blissing out and being
Okay.
unaware.
Okay.
The most important thing about meditating is awareness to start.
Yeah.
And so what I have people do is really to sit quietly in a dark room, no distractions, no phones, nothing that's going to jar them,
Right.
and sit quietly, close their eyes, or, sometimes it's like half lidded where you can only see just a little bit of light
Right.
coming in,
Yep.
and just be quiet and just
Hmm.
observe.
Hmm.
Because the first thing that has to happen is the observation that number one, our body is tense, so we can't relax our body, and where those places are that are showing up with restrictions or obstructions.
Yes.
And then secondly is to observe the mind.
Right.
What are the things what's the narrative that's always like popping in, right? Is it that I have too many things to do and I feel like I need to
Right.
accomplish something? Is it
Right.
a particular stress that's coming in? Am I feeling, is it my depression when I feel alone? Is it,
Mm.
whatever that is for people. And I think observing it and not attaching to it, not following it along and creating more storyline, but
Right.
just observing the free flow and the movement of those thoughts as they come and as they go.
Mm.
And what starts to happen over time is that, number one, you see the patterns recurring, right? All the
Right.
time. It's the
Right.
same few patterns that recur. And
Hmm.
then secondly is what you
So
learn is
meaning
that,
where the mind habitually goes
right.
in
Yeah.
meditation. And
Yeah.
also, I just want to underline something you had said earlier, that release from judgment. Like, oh, this happened to me back in the day, whenever it was, and oh, there's something wrong with, like, releasing that sort of judgment and guilt kind of
Right.
carries forward also into this present experience of meditation. Oh, my mind keeps wandering. Oh, I'm fidgeting. Oh, I'm thinking about this or that. There's a sense of acceptance and sort of
Right.
just being the watcher on the hill, observing, sensations and thoughts that go by.
Right. And also knowing that that's everyone's experience.
Yes.
There's no short circuiting of that process.
Yes.
It is a
Yeah.
process, right? Like, this concept in Taoism that's so often understood, this idea of wu wei, right? Or
Yes.
spontaneity, right?
Mhm.
Or non-action, right? And people think that means like, oh, just go with the flow, whatever you feel like, it's all good, right? It's all
Mm.
fluid, don't worry, be happy. And that's like really the antithesis of the Taoist path, right? The whole idea is that you have to work really hard to deconstruct a
Mm.
lot of beliefs, a lot of conceptual frameworks, and really let go until you can get to a place where you can experience that sort of free flowing spontaneity that's a natural
Yes.
emanation of something inherently you.
Mm,
right? But you can't do that if your ego is in the way. You can't do
right.
that if you're habituating in certain narratives and processes that just go on and on unchecked.
Right,
Right?
right. It's like the old samurai proverb, if you wish to dispense with method, learn method.
Exactly. Right. Yeah. Always you learn the form to perfect
Right,
the form to
right.
forget the form. Right.
Yes,
You
yes.
can't just forget the form. Right. It
Mm,
doesn't work that way. Yeah. And so when you sit in meditation and we call this meditation, even though you're not really meditating yet, right? But it's the process of deconstructing, right?
right.
And it's important to see how the mind works and to start to eventually create that little tiny gap and that
Mm,
space between the thought and the habituated reaction.
mm,
And eventually that space gets bigger and bigger and bigger. So we don't become a slave
hmm,
to our habituated thoughts. Because what happens as we habituate is that, and we create more action based on those habituations, is we, of
yes,
course, create more karma, right? More karmic
yes.
results. And then that cycle just doesn't ever stop. And so
Mm,
it's really important that we sort of, like a samurai, right, use that
yeah.
sword and just sort of slice through and
Mm,
cut away, because that's really the process. It's about cutting away these things so we can get to more natural states of who we are.
mm. Right. I remember Lonnie talking about, and from his perspective, he defined illness as habit
Yeah.
and health as a spontaneous response to an expression of life in the moment, based on the highest that one is aware of in one's own heart.
Right. Yeah, absolutely.
So we
And
have, yeah,
in creating that safe space for patients to do that
yes,
and modeling it, right? That's one of the big things, that Dr. Hammer always talked about is, we have to be a model for our patients of
yes,
this, right? It's
do
hard
as
to,
I do.
yeah, it's a key component in creating that safe space for people to sort of have the courage to really move down this path. One of the things that he said to me, I think it's in his books too, that really moved me many, many years ago. He said to
Mm,
me, your job as a clinician is to uncover that which patients fear is crazy in them and release them from that fear.
wow,
And to
wow,
me, that was like,
oh
that was the
wow,
whole,
that's
that was the
huge.
whole project.
That's huge.
Right. Yeah.
Huh.
Yeah.
Huh. So you've outlined this a very practical first step having to do with awareness, self-awareness as a key part or key initial phase of unknotting or undoing these knots of that have manifested as shock from prior trauma, and using meditation as a gateway into self-awareness as that part of that self-soothing, calm the nervous system path.
Mhm.
So, anything else you wanted to say about that, or is there, talk about another step?
Well, I think, you know, in addition to meditation,
Yes.
there's also just healthy lifestyle in general.
Mm,
We have to make decisions
yes.
every step of the way
Yep.
about what we do, how we act and behave, and the kinds of things we engage in, and whether or not that's something that is sort of in accord with who we want to be and the kind
Yes.
of health status we want,
Yes.
or is it something that's just sort of like, what you were quoting Lonnie is habit. And
Mm,
so we have to see the and take the responsibility of this. It
mm,
doesn't mean take the responsibility of the trauma,
right.
but it means to take the responsibility of how we perceive the trauma and
Right.
how we have decided to allow that trauma to impact the way that we want to engage in the world.
Yes. 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 And I remember many years ago, because I came into, for myself, I came into spiritual practice before getting into Chinese medicine. And it was actually that's what attracted me to Chinese medicine initially. It's like,
Yeah.
here's a way to help people that has this inherently spiritual foundation, or at least larger perspective, larger awareness, a cosmology, a way of seeing the world and oneself and
Mhm.
others and our place in the world and in the cosmos. But many years ago, one of my teachers, more on the spiritual path, talked about working with trauma successfully, being dependent on connection to the unhurt self. In other words, that there's the part of us that is hurt is an aspect. This is just how he conceptualized it, that the outer self has been hurt. The body, the mind, the personality, the human, the human facility, the human, the human part of the human being. And then he talked about the being part of the human being, that kind of, in his conception, this divine, eternal, spiritual aspect of ourselves, which is the unhurt self. And I remember Lonnie talking about this, and he said, well, it's the part of us that is beyond the reach of anything in this world. Like there's a part of us which is okay, regardless of the trauma and the resulting shock that happened at some point in the past, that there's a part of us which is just fine, and it's untouched by that trauma. And that really, that was like one of those, just like when you were with Leon, that kind of lightning bolt of awareness that connected me back to when I was, in my early 20s, late teens, learning about the unhurt self, and that to successfully work with what has been hurt, which is a real part of the human experience, of our own life path. We've got to have some connection to the part of us which is just fine, to the unhurt self. Could you comment on that, like just from your training, your experience, and from your very deep Taoist training as well? Like where does that land?
This speaks to the major dichotomy between what we call the Xing and the Ming in Taoism, right? So the Xing is sort of our inherent self. Well, I shouldn't even say self, because it's a non-duality, right? It is your part. It's the Tao that manifests within you.
Right.
And the Ming is sort of like the karmic imprints with the genetics and with all the acculturated ego and experience and so forth. And so there's in Neidan, in internal alchemy, there's different approaches of how to work with this. Some people say, work with the Ming and then you can reveal the Xing. And some people say, no, like in my lineage, it's about a dual cultivation of both of them. And part of that process, involves meditation, right? And sort of sitting quietly and finding that awareness.
Right.
The other part of it involves lifestyle, and in particular, what I was mentioning before, this understanding of how we behave in the world, and how that sort of creates the habitual karmic seeds to keep moving and being planted and eventually flowering and fruiting.
Right.
But for us, as Taoists, it's a big part of that is working with ethics, precepts, behaviors in particular ways, abiding by.
Very Confucian approach.
Well, it's a conglomeration of the three teachings: Buddhism, Taoism, and Confucianism, for sure. And so, that's a really important part. And it's true, the Xing, or that inherent part of oneself, is always untouched by those things. And there's layers and layers of obfuscation and turbidity that need to be sort of cleansed away. And the way that's done is through this process of, number one, meditating, number two, cultivational practices, and number three, ethics and preceptual work.
Yes. So there is this concept in Taoism of, even though it may not be spoken of in those terms, but there is the concept of the unhurt self in Taoism.
Well, except we wouldn't call it the self.
Right. No, for sure.
Because it's non-dual, but absolutely. That's the same general idea. Yeah.
That's excellent. And so before we go on to, we have, and we're very honored to have you teach a course in this subject. Before we get into that, any other thoughts you had that you wanted to share about trauma and heart shock?
Well, I think for patients and practitioners
Yes.
to understand that it's a process,
Yes.
right? It's not, it's really not a magic pill.
Right.
It's not, oh, I've made the diagnosis, now take this herb, or now take this formula, or take this acupuncture point prescription. It's always working with the individual in front of us, because
Yes.
everyone's treatment's different. With the
Yeah.
way we relate to every patient is different. And
Mm.
that idea of the Ganying and the creation of resonance, I think,
Mm.
is really the most important thing. So when I see a patient, the first thing I do on my initial visits is I spend about an hour plus. 30 minutes of that time roughly is feeling the pulse,
Mm.
and then 30 minutes is sort of like dialogue. I get a
Yes.
history, I understand
Yes.
what's happening, and then at the end I take all that information and I sort of spit it back at the patient
Mm.
by tying in all the findings from the pulse,
Yes.
explaining why all the signs and symptoms and so forth are there and how they've
Huh.
manifested.
Yes.
And I always have a box of tissues on my desk,
Oh, for sure.
because people are always crying.
Yeah.
Because it's one of the first times that people feel heard. It's one of the
Yes.
first times that people have a sense that someone understands
Yes.
their experience of
Yes.
suffering. Not just some clinical, you are depressed because you have liver stagnation or whatever it is, but you get the whole sort of picture, and you can see the gestalt, right? You have
Yes.
the big bird's eye view,
Yes.
but you also have all the nitty-gritty communicational issues that are taking
Yes.
place in all the areas and organ systems and dysfunctions and so forth, and maladaptive responses and
Mm.
all of these things. And just by having someone else know that you get it, you get
Mm.
them, and you see their suffering and you understand their suffering, that in and of itself is the beginning of the untying of the knot.
For sure.
That loosens the knot considerably.
For sure. Yeah.
So
Being heard, acknowledged,
yeah,
accepted, understood is a huge part of the treatment.
and creating the narrative, a different narrative for the patient,
Yes.
creating the story
Yes.
that they can understand things from a different perspective, really, I think, is the healing. That's where
Mm.
it starts.
Mm.
So there's a gazillion ways to treat it from there,
Yes.
right? You can give them
Yes.
herbal supplements, you can give them dietary work, you can give them acupuncture, you can give them essential oils. It doesn't matter,
Sure.
because the healing has begun, and
Right.
you just need now to sort of create more impetus and movement and spark to allow it to continue. And
Mm.
that's really the issue. And so that process happens faster for some and slower for others.
Yes. Yes.
And we have to sort of be attuned to that little bit of a dance and where we need
Right.
to move.
Right.
Yeah.
Beautifully put. Beautifully put. So I'm just going to put up on the screen here, and I gave folks the link in the chat. We're really honored here at the Gaeta Institute to have you teaching, bringing your decades of mastery in this subject to a course that's starting in just a few weeks,
Mhm.
which is called a Heart Shock: Diagnoses and Treating Trauma, Part 1. So I've given folks the link in the chat. If you just tell us a little bit about this course, Ross, and what people will learn from it.
Yeah. So the first thing we're going to do in week one is just sort of contextualize all of this stuff, because we have to really introduce what heart shock is all about,
Right.
right? Understanding all the myriad pieces that make up the umbrella term of heart shock, right?
Right.
All the different parts. We have to look at the different diagnoses. We want to look at how it's impacting the heart, the kidneys, the digestive system, the lungs, the nervous system, and so forth, because that will help us sort of be amenable to identifying these things when we see them, right? Because they're not necessarily all there at the same time, but we have to know which pieces are presenting and the sort of priorities of how they're presenting. And so what do those dynamics look like? What do those energetics look like? And then we want to sort of look at, well, now that we understand all the pieces, how do I actually diagnose it? how do I feel it on the pulse for someone, right? What
Right.
are those signs that are going to clue me in that this is really an issue of heart shock and trauma, and that
Right.
this is an issue of instability, right? And
Yes.
so we're going to look at things on the pulse. There's multiple findings on the pulse that we look at. We're going to look at the tongue, complexion. We can look at the palm of the hand, the abdomen, the eyes, all of these ways that we're going to sort of corroborate and
Mm.
understand the different dynamics of heart shock as they are manifesting specifically in
Okay.
the individual in front of us.
Yes.
And then, of course, we have to spend some time understanding the strategies involved. Because once we have
Yes.
our diagnoses, it's not just we go from, okay, he's got heart shock and let me just pick one of these treatments. We have to sort of strategize, right?
Right.
What we're going to do at this point. And the strategies, the way I teach it, sort of there's primary, secondary, and tertiary strategies, and
Mm.
and we want to prioritize them in particular ways, and that the way we prioritize them could look like the construction of an herbal formula, how
Mhm.
we prioritize dosaging and the chief ingredients and the ministers and assistants and so forth.
Sure.
It can prioritize the the manner in which we approach someone with acupuncture. Do we need to calm the heart and spirit first? Do we want to make sure we relax the nervous system? Are we invigorating blood here? Are we doing boosting up kidney adrenal functioning? Right. So how do we sort of navigate what's the entryway and what's
Yeah.
the step by step of how to
Yes.
go about that? And so that's what we'll do in the third week.
That's excellent. And Ross, just to be clear, does a person have to be an acupuncturist or Chinese medicine practitioner to take this course and benefit from it?
I don't think so. I really don't. I'm going to do my best to kind of approach this from as not as little Chinese medicine as possible, but more as broadly as possible, because I
Sure.
think, and I also would encourage, if there are people who are not Chinese medicine practitioners, there'll be ample time to ask questions, because
Oh,
I
great.
think there's ways of explaining things that are very accessible, I think. I
Yes.
think, Chinese medicine, like many other disciplines, has a lot of jargon and terminology that can be confusing, right, or
That's right.
misleading. And
Yeah.
so we want to break that down a little bit too, because we want to make it, it's not some exclusive club, right? We're
Yeah.
trying to make the work needs to be out there, and it needs to be accessible for people in, I think, all disciplines. And I think, even, for example, so one of the things I do in my book is there's a section in there where I tie all the different strategies that I list in my primary, secondary, and tertiary strategies
Yes.
to the steps and stages that Peter Levine uses as in his somatic
Oh,
experiencing
yes.
protocol,
Yes.
right? And so, and I do that just by sort of shifting the nomenclatures of things and showing that the similarities of these things. So I think we can do that for many different disciplines. It doesn't need to
Right.
be a Chinese medicine approach, because you don't need to treat it from Chinese medicine, because
Yes.
like I said, the real first treatment is creating the resonance and the narrative and the storytelling aspect of this back to the patient, and
Mm.
having the awareness and the understanding and the receptivity of what's happening. And
Yeah.
once that connection has been made, you know, you can treat it with whatever modality you want.
Hmm. That's excellent. I'm just going to put up on the screen here just something you said about making things understandable. And I just you've been noted by one of your teachers, Dr. Hammer, and just quoting from here, of great value is Ross's ability to formulate the essence of Chinese medicine in simple terms, accessible to the average person. So really appreciate you bringing that out, and Leon, saw that as well in your teaching of making, what can be very complex concepts very accessible and understandable to, the average person, to the lay person, to the non-practitioner, or to a practitioner who's doesn't have a Chinese medicine background. So
Right.
just wanted to bring that out. And also, from one of your other teachers who, many of us, revere as well, Jeffrey Ewan, also, talking about your ability to not only understand, but communicate these concepts in a meaningful way.
Yeah, thank you. And that was really one of the main goals of this book, was to sort of merge the teachings of these two great teachers together,
Yes, yes,
and create like a really a good synthesis of the material, because they each address it from different perspectives.
that's right.
And yeah,
That's right. That's right. That's because so this course is coming up just in a few weeks. Our first session is January 24th. So literally just a few weeks from now. And that's going to be on a Tuesday, 3 Tuesdays in a row, about an hour and a half each class, at 7 p.m. Eastern time, which is 4 p.m. Pacific, for these three, very, very deep, meaningful sessions from one of the most experienced practitioners, educators, and authors in this area of healing through trauma, which I really, I think is become a worldwide pattern. I mean, what you talked about in your practice, I've seen that as well over the last, 32 years, is that,
yeah,
the trauma is become, unfortunately, more the norm than the exception these days of what we've all been put through. And so,
and partly too, I'll say,
yeah,
one of the reasons for that, I think,
yes,
is it's not just that our lives are more traumatic than our forebears, right? Our ancestors. I think partly it's that our nervous systems are so overwhelmed and
Oh,
are compromised. And
right.
so we're all exposed to the myriad things that are breaking those nervous systems down. And so things breach the threshold, I think,
Oh, wow.
in a way that maybe they didn't before.
Right. Oh, that's such a good point. That the context of a dysregulated nervous system, what we might say in Western medicine might be a sympathetic dominance, or being predominantly living in that fight, flight, freeze state, sets the context for where, environmental or societal traumas affect us more deeply.
Yeah. So Dr. Shen had these terms. One he called nervous system tense, and
Yes.
of which there's two varieties. One is
Oh,
sort of a baseline
right.
nervous system tense as a constitution, and the other
Right.
one is sort of determined by circumstance. And then
Huh.
the other diagnosis was what he called nervous system weak. And
Oh,
so
okay.
those nervous
Okay.
system weak individuals are even, and you can go from one to the other,
Huh.
right? The more nervous system tension over time is going to sort of bleed into and create the preconditions for a nervous system weak condition.
Oh, that's very interesting, because I learned that pulse quality of the nervous system tense,
Mhm.
but we didn't get into as much of the nervous system weak part.
Yeah.
So that's very interesting. I'm just, my mind is spinning like all the ways we could address that in helping enhance resilience and stability in the nervous system.
Yeah.
That's awesome. So Russ, anything else? We have a couple. I think we have. It looks like two questions for you. But before that, anything else you wanted to say about the course? I consider this an essential course for like everybody to take, given our, current context of, societal nervous system dysregulation, and just this kind of collective shock and trauma we've all been through. So this is such a timely course. And anything else you wanted to say about the course before we get into questions?
Nothing in particular.
Great.
I'm really excited to bring it forth again, and I appreciate the opportunity to teach it on your platform. And I think it's one of those areas, like you said, that the ubiquity of the
Yes,
diagnosis
yes,
really deserves the time and respect of understanding it
it
as
does.
sufficiently as we can.
Yes, yes. And I do appreciate, Ross, your ability to make this very essential perspectives accessible to non-Chinese medicine practitioners. It's so important because it's such a like you said, an ubiquitous issue. So thank you for that. And we're just we're honored. Our little team here has been like, Ross is coming. Yay. It's just, we've been really looking forward to hosting you here. So let's see, just a couple of questions. And if folks have other questions, Ross has been gracious enough to answer a couple of questions that come in now. So let's see, first one is, so one who has had poor nutrition as a child can exhibit signs of shock. This is from Ray Woods. So one who has had poor nutrition as a child can exhibit signs of shock, correct?
It depends,
Right.
but for sure, any type of childhood deprivation
Right.
can be considered, or at least create the preconditions for
Yes.
a heart shock diagnosis.
Okay.
And in very specifically, so this is something that Dr. Hammer actually writes about in some of his articles. Especially, there's an article he wrote on the Chi Wild, which is like the systemic instability.
Right.
These types of early life deprivations are one of the etiologies for sure of that.
Yes. Yes. Great. Thank you. And Christy, another practitioner, is asking, what's a great source for learning to undo these things and the busy? So I guess the first answer would be this course would be very specific for
Well,
that.
yeah.
And what else would you suggest, Ross?
I mean, my textbook has it's there's so much in there.
Yes.
Eventually I will get around to teaching all of it, but there's each chapter in part 2 is a treatment, a whole separate, distinct treatment methodology based on the different channel systems. So I go through it from the primary channels, the sinew channels, the low vessels, the divergent channels, the extraordinary vessels. So each one. And so the first half of the chapter is an exploration of the dynamics of what those channel systems are.
Wow.
And then the second half of the chapter is like, how do you use it?
Yes. Yeah. Jeffrey goes into quite a bit of detail on that, I recall from studying with him. That's awesome. Thank you. Good. And our PDA is available. Yes, we will have 5 NCCM PDAs. I'm going to make a small contribution to the course material in addition to Ross's 4.5 hours of material. This is a subject that's near and dear to me as someone who's had personal experience, but also clinical experience in this area. So yeah, there will be 5 NCCOM PDAs available, Cindy. And Ray is asking, would parasympathetic dominance be considered nervous system weak? That's interesting.
Well, it can be either or, depending on the constitution. So what happens is that with the nervous system weak condition, what we see is the person who is in that sort of parasympathetic, yes, well, right. Well, you can see someone in nervous system weak who is sympathetic dominant, but doesn't have the capacity to do it, right? So their kidney adrenals are tapped.
Right.
So they're constantly sort of on this like wheel where they're hyper vigilant all the time, but it's really burnt through their kidney yang.
Right. Okay. That's great. And Andrew asked about what the name of your book is. I put links in the chat to Ross's books and his website. It's a great website. He's got a ton of information here of his teachings, articles, podcast interviews like this one and others. So he's got a fabulous website with lots of great resources. So we'll just do a last call for questions for Ross. And then we'll close this part of our show. Okay. Well, it looks like we've done it. Ross, thank you so much. First of all, I really want to appreciate your dedication to very deep, going really deep in our tradition in Chinese medicine, and going deep in this area of practice, which has really just essential to humanity right now. And I'm just thinking of all the thousands of patients you've helped over decades of practice and all the people they touched in their lives who have been blessed by their changed presence. As I like to say, as practitioners, 98% of the effects of our treatment we never see. because it's in how that person shows up differently in their life and
Yeah.
has a greater blessing to those in their world who will never meet. And then it goes on from there to everyone else, that they touch, the degrees of separation. So thank you for your just dedication to mastery in this, kind of lifelong subject of Chinese medicine practice. And thank you for just sharing generously of your, remarkably deep accumulated knowledge from, decades of very, very dedicated study, and just making this accessible to people. Like, hey, this is what I've learned. And here's how, you can use it to apply in your own life and in your own practice. And then, and also thank you for bringing this to the Gaeta Institute. We're just deeply honored to have practitioner, educator, author, clinician of your stature in our profession, bringing this to a larger audience. So just much, much appreciation for you. Just gratitude for your, depth of understanding and willingness to share it.
Thank you. I really appreciate it. And I really do feel like it's my pleasure and my privilege to be able to be here. And I
Yes,
appreciate the opportunity for sure.
that's great. Well, thank you, Russ. And anything else you want to share just to feel complete for today?
I just, I hope the material and the topic resonates with people. And I really hope to see a lot of you guys in the course starting in a few weeks.
Yeah, for sure. For sure. Yeah, I'm quite sure we're going to have a lot of folks who want to benefit from this incredibly timely subject from someone with your depth of understanding. So thank you. Great. Well, thanks for being with us today, Ross. And we'll see you in a few weeks in the course. And I will put one more time in the chat the direct link where you can get all the details about the course and about Ross on in our school website. So thank you, Ross. Many
Great.
blessings, and we'll
Thank
see you in
you.
a few weeks.
Yes.
Well, wow, that was quite an exploration with just such an esteemed practitioner in this area. So really look forward to seeing all of you. I can't, I mean, it's going to be hard for me to wait 3 weeks to learn this material from Ross. This is the part one of this subject, and there are, other parts to follow, we hope, in the months ahead and years ahead, because this is so foundational for all of us to understand for our own life path, and for those of us who are practitioners of whatever discipline, whether you're a chiropractor or an acupuncturist or nutritionist, naturopath, physician, whatever, anybody working with patients. This is really essential stuff. So really grateful for the perspective, but also the specifics that Ross gave to us today, and really look forward to this course. It's going to be incredible. So that's great. All right. So what we're going to do now is, with the time we have left, I'm going to take some questions. We've already got questions starting to come in our chat, and then I'll if you want to stick around, I'm going to play the kind of iconic New Year's song for you on the piano, Auld Lang Syne, and then we'll close for today. So there it is, and let's see. Yeah, so a couple of things. I'm just going to put a couple of important links to our school and clinic here in the chat, which we'll talk about. Has our main page at michaelgaeta.com, our functional medicine program, our course page, and the link to these weekly gatherings to share with your friends, because it's important stuff. So let's see, we've got a question here from Dr. Barb. Hi, Dr. Barb. Patient with inflammation throughout the whole body with pain, and through NRT, which for folks who are not familiar is a muscle testing system, nutrition response testing, on lots of immune products and stealth protocols. So that's immune support and also clearing low-level infections protocol, which is really important one for these days. mostly large joints, I suppose, and difficult to move. Taking turmeric, tuna oil, Livoplex, high A1C. So we've got some glycemic issues. High A1C is hemoglobin A1C, which is glycated or glycosylated hemoglobin, which is hemoglobin bound to glucose inside the red blood cell, which gives us a 2 to 4 month average of blood sugar, upper limit of 5.6, 5.7 to 6.4 being prediabetes, and 6.5 and above with glucose of 130 or more is diabetes. So just kind of explaining some of the shorthand that Dr. Barb has put in here for folks who are like, what does that mean? High SED rate. So this is erythrocyte or red blood cell sedimentation rate, which is just how long it takes for the red blood cells to kind of settle down to the bottom of the vial, basically, which is a non-specific inflammatory marker. That marker in a blood test should be 15 or less. So that's a measure of inflammation. So what we see with this patient, Dr. Barb's patient, is they've got some inflammation somewhere. Doesn't necessarily tell us, the SED rate doesn't tell us where, but it tells us it's there for sure. So we have chronic inflammation, very likely chronic, based on symptoms, and a dysregulated blood sugar. So we have an elevated blood sugar, and started taking like some steroids with some help, not sure where to go. Large joints feel tight. Yeah. Okay. So, so it sounds like this is, from what we can tell, this is systemic inflammation, and with symptoms, of pain throughout the body. And looks like the support strategy is focused on the immune system, which is always a good idea. I mean, that's never not a good idea. And it's just more a matter, it sounds like, of priority. So what's going to happen here is this high sugar, high insulin is going to be, one of the drivers of inflammation. So, this, a couple of first steps, and these are perhaps things you've done already, is to look at the diet and the lifestyle to look for things that might drive inflammation. So a sugar, high glycemic, low fat, which is going to be pro-inflammation sort of diet would be, something to look at, as well as lifestyle. What are the patterns of rest and exercise that are, what's going on? We always start with lifestyle. So diet, exercise, rest, breathing, it's kind of the basic foundational stuff, which is the foundation of everything else, is looking at those lifestyle factors. I would be curious to see what the CRP is, whether it could be cardiac, but it's another inflammatory marker. The two other inflammation markers are C-reactive protein, which is generated by the liver as part of the inflammatory process, and the uric acid, which used to be thought of as just a kidney marker, but it's really a systemic marker for inflammation and metabolic syndrome in many patients. So looking at CRP, upper limit of 1, looking at uric acid, upper limit of 5, would just be extra data, to look at. Certainly looking at a CBC with white cell differential and platelet will give us a clue as to, is this acute or current measurable infection driven? And clearly, there's a lot of chronic inflammation, which is not solely driven by infection. And chronic infection, chronic low-level infection won't always show up as measurable elevations in white count or neutrophils or lymphocytes or whatever. So, so looking at the diet, looking at the lifestyle, testing wise, I would also look at the omega-3 index. So that's available also through standard process as the omega-3 index plus. This will tell us if there's a nutritional contributor. And what I've seen over the years is sometimes it's just a direct cause of the inflammation is a low omega-3 index. Oh, had COVID last year. That's good. No shots. Oh, thank God. Wow, that's fabulous. That's great. So her chances of surviving the coming years are much greater, not having the death shot, the genocide jab. No shots, uric acid 5.4. Okay, so she's edging into, so that's consistent, Barb, with the high A1C and chronic inflammation. Uric acid is going to show you kidney, it's going to show you inflammation, it's going to show you metabolic syndrome. So insulin resistance, dysglycemia, that's all the things, all the, some of the main layers of uric acid, but that is a little high, not a lot, it's a little high. Yeah. Oh, and by the way, you can also look at ferritin, which is a secondary inflammatory marker. Ferritin can go up with it, and that should be like 80 to 150. Some of my students over the years have been ER docs who have seen ferritin go up within hours following a physical trauma or an acute infection. So ferritin, is can be a secondary inflammatory marker. Anyway, and has have I found ferritin 59? Okay, great. So that's good. That's good. But yeah, there's some inflammation. So a couple of things. Check the omega-3 index. You may also, I would definitely, and I'll give you the link here. You want to check. That's a long-term thing. This isn't acute, but I'll give you the link. Make sure you do a hair analysis and looking for heavy metal toxicity. And you can download, just click on that link. You can download to your computer how to get some free hair analysis for your patients. And so you want to look for heavy metals that for some people will be a definite driver of inflammation for sure. Now, the other thing is we want to, kind of put the fire out, so to speak. And if you're not a practitioner and you want to get a hair analysis, you don't have a practitioner, you can just order one from our store. The link is there, michaelgaeta.com/store1 with the number 1. So your turmeric forte, hopefully that's the turmeric you're talking about, is a very good idea. However, what I've seen is kind of underdosing from practitioners. A very powerful formula, about 6.5 grams of turmeric extracted per tablet. So that's a pretty significant amount of turmeric, given that the average dietary daily intake in India, for example, is 2 grams. In one tablet, you're getting 6.5 grams, and she's on 6 a day. So that's a aggressive dose, which is what I would do. You've also got to sort out the omega-3. That can be a major driver of inflammation. Look in the history of fiscal trauma. That can be a factor. And dietary factors as well. I will probably also add the Boswellia complex, specifically because it's this pain in the joints. Tuna 3 a day is a start, tuna omega-3, but I would add to that 3 cod liver oil. And I might even add to that, based on omega-3 index, an additional 3 Prima EPA DHA. So if the omega-3 index is below 8%, I'm going to get pretty aggressive, sorting that out before retest in 4 months. So typically I'll do 3 cod or 3 tuna plus 3 Prima if the omega-3 index is low, and retest every 4 months until it's good. Was on Boswellia, no help. Okay, Saruta Plus is going to be really very, very important. That's the organic buckwheat leaf and seed. And I typically, in these cases, I'll start out with 12 a day. In an acute injury, or just, me after my stem cell PRP treatment a couple of weeks ago, 16 Saruta Plus, that's great. So then, we've got to make sure we're covering broad general support would be another kind of layer, which would be a broad formula like Catalin or Epoise or Ligaplex 2 with trace minerals B12 at 3 a day, calcium lactate at 3 or 4, even 6, probably 6 initially per day. So those would be a couple of other things to consider, and kind of another layer. And then looking at circulation. So the boswellia, turmeric, buckwheat, the Ceredoplast combination will certainly address that. And in some cases, with these kind of situations, we've got to look at, so it sounds like your doses and formulas are good. Looks like the fish oil dose is a little light. And make sure you have, systemic support in there. Livoplex may not be like super specific right now. But you also may want to look at if they're getting benefit from steroids, then adrenal support often is helpful. So things like, and by the way, in this, Echinacea Premium is a perfect formula for both inflammation and immune support. I'd probably, lead with 4 to 6 a day. Livoplex may be less important. That can be very useful. Other things which tend to reduce inflammation and help with blood sugar, both. You always look for formulas with overlapping functions, would be black cumin seed. I've seen great benefit from that for both blood sugar and inflammation and joint pain. So, leading with a kind of a loading dose of 4 a day of the black cumin seed forte can be very helpful. We talk about that a lot in terms of kind of current support in a, kind of COVID and injection context. There's a link there for folks who want to learn more. So those would be a couple of things I'd be thinking about, as well as a lot of formulas that can address inflammation. But these would include Echinacea Premium, black cumin seed forte, and also ashwagandha. Hard to find something. It doesn't help, but it also tends to help with blood sugar, and it's kind of a second formula, even tertiary, for inflammation. And if blood sugar is high, that's got to be addressed. So like a Gymnema Diaplex combination can be very useful. And Sharon's saying, also found some may have a low omega-3 index if they're a fat malabsorber. Great question. I was just about to talk about circulation and a beta food as a great circulatory enhancement from the organic beets, supporting nitric oxide production and so forth. So if they haven't ever taken beta food before, I always kind of lead with that with a new patient to unblock the liver, improve circulation, support endogenous endothelial nitric oxide, in a natural way. That's always a great lead formula. So, as I said, adrenal support can be really useful. Maybe their multi is Drenamin with B core, 9 Drenamin, 3 B core, or 4 B core might be good nutritional adrenal support. And really anything that supports the adrenals, like adrenal complex, for example, which is a 2 Chinese herb formula of licorice and Romania root at 2 or 3 a day, can be very useful as adrenal support. And not surprisingly, the adrenal herbs tend to help with blood sugar because that's, the adrenals are part of the blood sugar triad with the liver and pancreas. So yeah, Christy's talking about beta-col with the Rosalind Wolzin's anti-stiffness factor for sure. Any joint stiffness anywhere in anybody, they're getting a little bit of beta-col in that Livoplex. My suggestion would be to, kind of finish up the Livoplex and look at these other formulas. And you can just switch to straight beta-col at a loading dose of 6 a day and then go from there. So those are a bunch of ideas that I think will really help. On top of, looks like you've done some great foundational work here, Barb. So very, very good, formula selection and dosing. So well done on that. And hope these additional suggestions will help. Great. Beta-col is not a protomorphogen. So there's no protomorphogens that I'm aware of in the beta-col. And so, yeah, dosing would be with everything else. Now, if they're taking ostrophin, Biost, these are protomorphogens that would be taken on an empty stomach. Or you can, and also there's kind of there's a Ostarplex, which is a very broad formula with a bit of ostrophin and phosphid, that can be, it's kind of a common, and also a little bit of beta call. Ostarplex can be useful. I typically will lead with beta call, but if you want a broader formula, it would be Ostarplex at least that. Oh, there's a little bit of hepatrophin. That's right. That's right. Yeah, I wouldn't be too fussed about that. You could dose on an empty stomach, but I with beta call, there's not a lot of hepatrophin in there. I think if you were going to give them separate hepatrophin, and even the Livoplex, 2 Livoplex gives you 1 hepatrophin. Livoplex will sometimes work a little better on an empty stomach. So kind of upon rising before bed, because if they're taking, say, 6 Livoplex, that includes built into it 3 hepatrophin. So yeah. So yeah, I don't consider beta call a significant source of protomorphogen. I think it's great that it's in there, but not ultra critical that it be on an empty stomach. Yeah. Okay, last question, and then I'm going to play the piano, and then we'll see you next week. And make sure you register for Ross's course. I gave you the link. Use your Mondays with Michael discount code for that course, MWM10. So you get your discount on his course. It's going to be great. And I'll also, as I said, I'll be expanding on some of the thoughts I had today. I'll be adding my own training on trauma and healing through trauma and shock as well in that course. Standard process several times for MP. Yeah, that's not going to be too fruitful of an exercise, Christy. I don't think I would spend any time asking them for the empty stomach list. That's very much a clinical question, and that's not going to be their main area of expertise. So yeah, there isn't an empty stomach list. But the new CRG does have a list. Yeah, those are the main ones I would say, is the protomorphogens and GI adsorb. Ochrapepsin ideally is on an empty stomach. Calcium products, not necessarily. But that's pretty much the main list. There are other formulas, but typically it's protomorphogens, ochrapepsin for how it's usually used, definitely GI adsorb. That's basically the list. That's it in most cases. And calcium containing products, that's very conditional, not necessarily empty stomach. So I wouldn't get as fussed about that. Is osteoarthritis enough in itself to raise CRP? Anything, any really acute even or chronic inflammation can be enough to raise C-reactive protein from the liver. So yes, the short answer is yes. But really any source of acute or chronic inflammation can cause the liver to produce CRP. Also a fatty liver, insulin resistance, all of those things can contribute to a raise in C-reactive protein from the liver. So it's an important marker. And then we have the different marker of cardiac or high sensitivity CRP, which is a different analyte in the lab that the lab will use, is another one more specific for vascular inflammation rather than the non-specific, but helpful, measure of just sort of general, CRP. All right, very good. So those are hopefully some good ideas there. Great question there, Barb, and good to consider that with you. Those of you who want to go deeper on this stuff and are into, especially if you're into standard process Medicare, but even if not, we have kind of the best, most comprehensive, most effective training in standard process and Medicare and functional medicine and the business side that is available anywhere, which you can learn about at cliniciansmastermind.com. All right. Well, thank you, everybody. I'm going to play the piano for you a little bit now, and a little bit of New Year's cheer and blessings to New Year's blessings for you and yours for a wonderful 2023 together. Really glad to be with you on this journey in this life where we all came at this time to serve in the global awakening. So with that, this is an old Scottish tune called Auld Lang Syne that I'm sure you'll recognize. I'm going to get my tree. This might be the last time you see the tree. I think the kids and I are going to take this big boy down before we're together again, maybe next Monday. And blessings to you and yours for a wonderful, creative, successful, prosperous new year that we begin now. All right. See you next week, everybody. Here's some Auld Lang Syne. Okay. See you next week.